what it really means to live with hearing loss.
Throughout my life, I was never able to hear a bird chirping.
Steps you can take today to protect and preserve your hearing for tomorrow. We help separate fact from fiction. Plus, the vital role hearing plays in childhood development. What every parent should know. All on Health Sense.
Funding for this program was provided by Cleveland Clinic, Florida, and generous viewers like you.
Hello, and welcome to Health Sense. I'm Chris Curl. Our hearing is something that, unless it's compromised in some way, we often take for granted. An estimated 28 million Americans suffer some level of hearing loss. In addition to that, environmental conditions expose 30 million more people to noise levels that are likely to result in permanent hearing damage. But only 6 million Americans use hearing aids. The numbers tell the story. While tens of millions suffer from some degree of hearing loss, the majority of these people don't seek or take advantage of treatment. So, despite advances in hearing technology, millions of people are not hearing as well as they could. What can affect, even harm, our hearing? Is cleaning your ears with cotton swabs really dangerous? Is there any truth to all those warnings about listening to loud music? And should losing your hearing be explained away as just a natural part of aging? We asked the experts to help us separate fact from fiction.
We hit our experts with some of the most common ear-related questions and misconceptions. Up first, the common cotton swab. Fact or fiction? Is it really dangerous to clean your ears with cotton swabs?
Fact. Big fact. Your grandmother told you never to put anything smaller than your elbow in your ear. Don't put anything smaller than your elbow in your ear. Cotton swabs are a no-no. They tend to pack wax down in further. Probably a lot of wax impactions are caused by patients seeing a little bit of wax coming out in the end of the cotton swab and pushing most of it down in next to their eardrum.
Which brings up another big misconception. Fact or fiction? Is wax in your ears really a bad thing?
Fiction. Wax is natural. You should have some wax in your ears. Many patients create a situation where they produce excessive wax because they're constantly cleaning their ears. Really, if you don't have an excess, and really your physician should tell you whether or not you have an excess of wax, you don't need to clean your ears. Your ears are really self-cleaning. They will take care of themselves, and you need to do very little.
Hi, Dr. Roberts.
How are you doing today?
Okay.
Good. Have you had any difficulties since we last talked? Probably the most common reason for a tympanic membrane perforation has to do with ear infection. When one has a middle ear infection, pus builds up behind the eardrum, and often it's under enough pressure that it actually will cause the tympanic membrane to rupture.
Whatever the cause, most eardrum perforations heal on their own within a few weeks. Way beyond cotton swabs, recently, an alternative approach to ear cleaning called candling has been causing a buzz.
Ear candling, you insert a hollow candle into the ear and it creates a suction vacuum effect. That's what's going to draw out materials, debris, anything that could have gotten in the ear that doesn't belong there, and excess wax.
Margie Stevens teaches a course in ear candling and says people who have had it done report that it helps a variety of complaints.
Better hearing, ringing in the ears, which they had previously had, tinnitus, that has disappeared. They may have had a headache and they had the procedure done and the headache went away. Could have been from a sinus headache, and it really does clear out the sinus. It creates a vacuum, and what it's going to do is start sucking the debris out of the ear, whether it's excess wax, possibly water. The procedure takes approximately 20 minutes per ear. Sometimes a little faster, sometimes a little slower. But you need to do both ears to keep that equilibrium because of the fluid in the ears. I mean, that is our balance, so you have to be careful about that. Okay, I'm just going to grab the candle from her now. Remove it from her ear to extinguish it. Some of the fuzzier looking debris here, that's part of the candle. Now, there's not a lot of wax that came out, but this darker underneath there, that's actually wax.
It's just so simple and very gentle, and you know, you just have to be smart about the process.
I haven't seen problems like I have with many over-the-counter wax removal products and Q-tips and so forth. So I mean, I can't say I can endorse it, but it's not like I'm seeing problems from people who do it.
You know, candling's probably okay. I would worry about setting my hair on fire, so I don't think I would do it. But I don't think you could really do any harm. Again, I don't think you need to really clean your ears, but some patients